Ladies and gentlemen, welcome back to the channel. I am Dr. Dawson, and today we are going to talk about heartworm. What is heartworm? How is it spread? And why is it important? And then in the following few videos, we're going to talk about heartworm prevention specifically. So let's get started. As we get started here, guys, I just wanted to say a special thank you to the American Heartworm Society, who are a group of veterinarians who are committed to educating and helping to end the heartworm problem that we have here in the United States of America. So as we get started, I just wanted to say thank you to them. A lot of this information has come from them and other sources that I will link in the description below. So as a veterinarian here in the Midwest, I don't see a ton of heartworm cases, and this is for a couple of reasons. One, mosquito season is not all year round like it is down south in the Florida, Texas, somewhere, all those places down in the Gulf states. However, it does happen quite frequently. We see probably 3 to 5 cases per year that are heartworm positive. A lot of these come from a few local infections, but the majority of them are dogs that are from down south, and they have come up here to the north for adoption, and so we do see a few of those as well. So what is heartworm disease? Well, heartworm disease is a specific parasite that will infect the circulatory system of dogs. It's of the genus Dirofiliaria, and the species is immitus. Dirofiliaria immitus is the full name of the organism that causes heartworm disease. It's a small worm that will invade the circulatory system and get caught in the pulmonary arteries, so just past the heart in the lungs, and this worm will basically feed and reproduce in that part of the body. So essentially it causes congestive heart failure in dogs mostly. We'll talk about that in a second. Typically will cause heart failure in patients through a physical obstruction of the outflow from the heart. How is heartworm spread? Heartworm is spread through a specific vector, or you could call it a host, that will spread it from host to host. And this specific vector is the mosquito. Now, mosquitoes are prevalent in much of the country, but typically in places where there's a lot more moisture, the Gulf states, and anywhere where there's a lot of water. The chance of spreading of this disease is a lot lower in our area just because there's not mosquitoes for so much of the year. So we will start the heartworm life cycle in stage 1, which is called microfilaria. And now these are the tiny little baby worms that are circulating through the initial host's bloodstream, waiting to be picked up by a mosquito. Then the mosquito picks it up, it matures into an L2 and then into an L3 in a mosquito. And this is through 10 to 14 days in that mosquito. And then that mosquito is going to actually bite another animal, usually a dog, and it will deposit those now L3s onto the skin of the next host. The next host will then have a small puncture wound that the L3s will go into, and they'll actually infect it through that physical trauma to the skin that the mosquito produces. And then it will burrow down into the dermis. Now, while it's in the dermis, it's gonna do a little bit more maturation into an L4. This is typically going to happen within 3 to 4 days of initial infection. The L4 is then going to mature longer, and as it gets close to maturity, at the end of 35 to 45 days, it's going to actually mature into the next larval stage, which is called L5. Now, L5s are basically immature adults. They have the adult form, but they are not yet able to reproduce. The L5s are typically going to be found in the bloodstream. So they're going to burrow into a vein, and they're going to get caught up in the pulmonary artery, or one of the pulmonary arteries up in the lungs. Now, as they grow and mature, they're going to turn into full-fledged adults, or L6s. And at that point, after 4 to 5 months of maturation from an L5 to an L6, they're going to start producing microfilaria and breeding. Now, they do have to have males and females in order to reproduce. So if you just are infected by a single heartworm, or a dog is infected by a single heartworm, it will not be able to reproduce appropriately. Now, in dogs that are infected very heavily, these heartworms can actually be backed up, and you can find hundreds upon hundreds of heartworms within the pulmonary artery and in the heart. And in some cases, in dogs that are really, really heavily infected, surgery has to be performed to physically remove them before we start treatment, because otherwise it will kill the dog during treatment, which we'll talk about in another video about how do we treat heartworm. Now, the adult heartworm can survive for up to 5 to 7 years in dogs, and typically no more than 1 to 3 years in cats. So adult heartworms have been found in many different species. Most of the canids seem to be very susceptible, and so coyotes, wolves, jackals, etc., all of them seem to be able to get heartworm pretty easily and high loads. Now, when cats get heartworm, which they do get, and maybe I'll make a special cat video, they typically don't reproduce normally. Typically there's a small number of worms, and even if they are reproducing, they typically are not able, the microfilaria are not able to survive long term and be picked up to be spread to other hosts. Other species that have been found to be infected include bears, sea lions, and occasionally humans. One other species of note is the ferret, and they tend to be a little bit more susceptible than cats, but typically not as susceptible as dogs, and part of this is just going to be exposure to mosquitoes. They're not nearly as exposed as dogs typically are. So why is heartworm such a big deal in veterinary medicine? Almost every single vet that you go to is going to recommend heartworm prevention. So why is this such a big deal, and why do vets push heartworm prevention so much? Well, heartworm prevention is basically killing the 3rd and 4th stage larvae, and I'll talk about that in another video, but it is able to kill them right after they're infected. Now, why do we push for this so much? Well, in dogs, typically we find that the disease can be very severe, and it's very preventable. It's not just a marketing scheme or a way for them to make money, but it's actually a way that we can help keep our dogs healthy. By using heartworm prevention, we're going to not only prevent our dogs from getting heartworm, but we're also going to prevent our dogs from being a host that spreads heartworm. As we found that one dog in a community that has heartworm drastically will increase the amount of dogs in that community that are going to develop it. And if it is missed, it can cause very significant and severe disease, and even the treatment for heartworm can be life-threatening. And so we want to prevent this in our dogs, because when dogs undergo congestive heart failure, it can end a dog's life in a matter of a year or two, rather than their typical 10 to 15 to sometimes even 20-year lifespan. And it's something that we can very easily and relatively affordably prevent with minimal care and easy prevention methods. That'll wrap it up for this video, guys. In the next video, we are going to talk about heartworm prevention exclusively. So in that video, we're going to dive into what it is, how it works, why it is pushed for so much, and is it safe as most veterinarians and people will say that it is, or is there a dark side to heartworm prevention? We'll get into that in the next video. And if you haven't already, make sure that you guys like and subscribe, as it really helps out the video, and we're going to continue producing new content like this. I also have produced quite a bit of rabbit content, which you can find up here. And if you want to find out something about rabies, you can look at this video. If my next video is already live, you'll probably find it down here. Have a good rest of your day, guys. We'll see you in the next one.